by Michelle Hoad, CEO of the Medical Laboratory Professionals Association of Ontario. Michelle, good morning. Thank you for your time today.
Good morning.
These are some big numbers we're seeing, past testing capacity here, past that 20,000 mark. How did you do it?
Well, it's interesting. If you think over the last 12 weeks, we've now completed 800,000 tests. We started with 4 labs. We're now reached over 30 testing centers. All this was done while we were understaffed. So it's quite incredible right now.
And you say that has been a chronic problem, right?
It absolutely has. One thing we've been struggling with, just overall in healthcare, it seems to be lab is an afterthought. We've been extensively underfunded, continuously understaffed, and it's something that we need to start talking about because we are talking about a second wave, but also all the additional tests that are going to start happening once we get to elective surgeries. It's the same group of people that are doing this testing, but there's more tests going up. So we're going to start to see a crack.
So do you think that labs kind of come to the people think about them only when we need them? Like really, we haven't had our attention drawn to this because we really haven't seen a pandemic like this ever.
Absolutely, absolutely. When you think about going to get tested or you go to a hospital, the first person you see is a nurse or you see a doctor, but no one really ever takes a moment to think, where exactly do my blood go? Any specimen that I have taken, where does it go? It actually goes to a group of people who we never see. So you are 100% correct. It is a group that is an afterthought and we are forgotten. And right now is the time where we can't be forgotten. Some of the results we're seeing right now, we did some survey with our members. 50% of those that are currently testing are working double shifts. The turnaround times are being affected. We've got 82% that are feeling burnout. We have people that have been working 24/7 for 12 straight weeks and have just been advised that their vacation's now canceled.
And also part of this burnout survey too, you're talking about too, Michelle, 90% say morale is affected after being excluded from pandemic pay. So this seems like, another slap in the face with people that are already working so hard. And as you just mentioned, literally around the clock.
Absolutely. There has been a few protests actually that happened yesterday in Cambridge, Sudbury, Thunder Bay, lab professionals, and other folks in the hospital that have been excluded, kind of getting out and voicing their concerns. But we need to, as the government really starts to look forward as to what's important, we need to make sure that lab is at the forefront. We have not enough people in our labs right now. The population in Ontario is growing. This is the first pandemic. We have regular lab tests that happen every day, 500,000 lab tests done every day in Ontario. So we need to look at expanding this group. You just can't grab a nurse and bring them into the lab. It actually has to be somebody who is trained specifically for this type of stuff.
So how does this change then going down the road here, Michelle? Is it the provincial government that has to make some changes? Where do you want to see the funding and the staffing levels change?
So the main issue we're having right now is actually at the programs. So there are lab technology programs across Ontario. There's 5 of them. What's ironic is every single program has a wait list. So we have a large group of people wanting to get into the program, but they can't. So we need the government to really look at expanding lab funding at those programs so that we can get more people graduating, certified, and then actually practicing.
Well, I know this is a lot of dire news we talked about today, but also just want to end off and just say hats off to you and your incredible team for reaching that $22,000 mark, or actually above that even too. So hats off, and let's talk again soon.
Thanks very much for having me. Have a great day.
That's Michelle Hoad, CEO of the Medical Laboratory Professionals Association of Ontario.